Okay, so everybody had a chance to do the quiz. How do they feel about it? No? That's okay, because so I've got actually some of the questions that you guys missed, and I'm going to kind of go over, I'm going to hit on all those points. But first, here's what I want you to do. Everybody's got a sheet, at least a couple of sheets of paper in front of you. The first thing I want you to do is I'm going to put up here a 3-minute timer. Okay?
Doesn't right. This one does.
You got it?
I get a
300. No, not 3009. What am I doing? Okay. All right. So you have 3 minutes. 3 minutes to write every medication that we as EMTs, we collectively, that means you too, and you, right, are allowed to give at our level, with or without permission from medical control. Let me say that one more time. You have 3 minutes to list out all medications that we are authorized to give with or without medical control as an EMT. Any questions on that? All I want is for you to list out the medications. 3 minutes. Are you ready? Begin. Two minutes, 30 seconds. No pressure. Just list out all the medications that we're allowed to give. One minute remaining. Thirty seconds. All right, time's up. All right, so those medications I had you to write down. Now what I want you to do is I want you to get together and I want you to write down all the medications on that board. Are you ready? Go. Again, collaborate, right? Work together to get all medications that you guys could think of.
I'm going off the National Registry, not our state.
That's what I want you to do. National Registry, that's what we train to.
You have to write bigger than that.
I could probably write. Okay.
I like that one. I don't know what's in, I don't know the actual drug.
Just for now, I want you to just write them all down. There you go. Just write them all down. So that way we get them all, make sure we get them all up there. Okay?
Yeah, it's not true. What's in the little poison control? I don't know. I think it's for something.
We'll talk about anything that we missed up there. We will we'll talk about it, okay? But it's that I believe that you're talking about. But we'll talk about it in just a second.
Yeah, charcoal. COL.
I'm not gonna write.
That's good.
Your R's look like C's.
How do you spell her name?
Who's?
Bernier.
BERNIER.
Thanks.
Tim, did you say to write the other one either way?
No.
Say again?
No, I don't know. I don't know the actual drug. I just know the brand name.
Never mind.
Okay. Do you both agree that this is a comprehensive list of all medications we are allowed to give per the National Registry?
No.
To your knowledge. To your knowledge. I mean,
Yeah.
is there anything else that you would like to add or take away? No. Okay. All right. So go back to your seats real quick. Okay. All right. So for aspirin, we talked about in your quiz, right? We talked about aspirin and nitroglycerin, glucose. We didn't talk about glucose a little bit in your quiz, but that's okay. Activated charcoal, right? Oxygen, ibuprofen, and Tylenol. What are those two drugs considered?
NSAIDs.
They are, but they're also considered what type of drug? OTC. What does OTC stand for? Over-the-counter medications, right? Albuterol, epinephrine, naloxone, and glucagon. Okay? And glucagon. Now, are there any drugs that maybe you feel that maybe should be removed from this list at all? Okay. Question. Are we allowed to give ibuprofen and Tylenol per National Registry?
No.
Yeah.
Why do you say yes?
It's in my textbook.
Okay.
Medications.
Why do you say no?
Here.
Now, there's a difference between carrying it and the ability to give it, right? Now, there are some drugs that we are allowed to assist in administration. There are some drugs that we are allowed to give, right? So, ibuprofen and Tylenol, is that something that we carry on our trucks? No. But are we allowed to give it? Yes. Right? But, and it's okay not to, again, we don't carry it, you're right. But we're allowed to give it. Okay. What about glucagon?
We don't carry it, but we're allowed to use it.
Are we? Why do you say yes?
We
Med
learned-
control orders, right?
Well, I'm asking you. You
Oh,
tell me, and then we'll.
Didn't we learn how?
Well,
I don't remember.
I saw it in my textbook.
Okay. All right. What about you? What do you say? Yay or nay?
Yeah, I'm pretty sure we learned about it.
We are able to give glucagon. When would you want to give glucagon?
Hypoglycemia.
But what? Can't you just give oral glucose?
If they're unresponsive and don't have it taken away or can't swallow.
How do you give glucagon?
Intramuscular.
IM. Did you learn how to give IM injections?
Mm-hmm.
You did.
Mm-hmm.
Okay. All right. And are you allowed to give glucagon as an EMT?
If I know this right, it's med control orders. Right?
Per med control. Would you like to +1 phone a friend? You have a SME sitting in the back. Would you like to phone a friend?
Yeah.
You're back by the Tommy.
Everybody.
So, your book says you're allowed to give it. But in the area, our area, they want you to call MedCom for that.
Do we carry it?
We do not carry it.
We do not carry it, right? So, but it's still a drug that you need to know. That's what I was getting at. Okay? So now, your next task. Now that we've got a is there any other medications that you would like to add to this? Now that we've talked about any of these?
Yeah. What's in those auto injectors, like the Duodil auto injector, like the ones that have? I think it's something to do with the chlorogenic gas.
For nerve agent antidote kits. Your
Yes,
nerve agent
that's
antidote
what I was
kits.
talking
Yes.
about.
So for nerve agent antidote, okay, you have usually it comes with atropine and 2-PAM chloride. Atropine and 2-PAM chloride. Those are your, but those you do. Those are for nerve agent. Okay. So those got atropine and 2-PAM chloride are your two drugs that you got in those. Okay. All right. Now, your next task. Are you two ready? You two are going to get together. Okay. And here's what I want. I'm going to write in red because it's important.
So, indication, contraindication,
Oh, okay.
and bed side effects.
Okay,
There you go.
thank you. I couldn't see it.
I thought that was. Wait, wasn't there one for side effects?
What was the question?
I swear on the quizzes it said the side effects was the secondary one. Because I know indication is,
Miss Diddy, did I forget anything?
isn't there one for side
I
effects?
don't think so.
I'm going to go over the definitions of each of these so you understand them. Okay.
Because I think on the quizzes there, it says side effects was secondary from another one. Contradiction.
Yeah, we're going to talk about that in just a second. Okay.
Indications, contraindications, adverse effects, side effects, contraindications.
Oh. Did I get everything?
Yeah,
Okay.
I'm from, yeah.
All right, we'll wait for him to get back, and then we're going to go over these definitions, okay, to make sure you understand them. Side effects / let me use the terminology that you find in the book.
Sticker.
What?
Okay, so when you guys get together, let's talk about these real quick, okay? Let's talk about these definitions. All right, so I want to know indications. What does indication mean?
Why are you using it?
When are you going to give it? What do you need to see, hear, do, smell, whatever it is that you need to do, right, to evaluate and indicate that this drug needs to be given? What is contraindication?
You don't get drug.
When would you not give it? A contraindication is I would not give nitroglycerin if their blood pressure is lower than
90. Is it 100?
100 per national registry. That's what we teach here, okay? Per national registry, it is below 100. That is a contraindication, okay? Good? So far? Okay. All right. Side effects or adverse reactions, okay? What are those?
Sorry. Side effects of the drug. What happens when? Skip.
Would you like to add +1?
Yeah, the other effects.
Okay, so it is what happens when we give the drug, right? What happens physiologically, right? Physiologically to the body when we give a certain drug, okay? So that's your side effects / adverse reactions, okay? So side effects can be either okay or not okay, right? So how do you determine the difference between side effects being okay and not okay?
How the patient reacts.
Say that out louder.
How the patient reacts.
Yes, it's how the patient reacts to it. Good. What else? But when do we know? When do we know when it's? How do we know it's okay and not okay?
Shoot something out there. When the patient is exhibiting similar like symptoms to the adverse effects.
Okay. Would you like to +1? Anything? Okay, so let's think about this. Okay, so if I was to give nitroglycerin, let's stick with nitroglycerin because sometimes it's easier to remember, right? If I was to give nitroglycerin, what are you going to expect, or what side effect can you expect with my blood pressure?
It's going to go down, right?
Is it going to go down? Yes. Why?
Vasodilation.
What does that mean?
The veins getting big.
The veins?
Oh,
Whatever.
you explained it to me.
Yeah.
It's the.
Arteries.
The vessels, right? Go ahead. Think out loud, Laura. Go ahead.
They get bigger so it can actually.
What's they? What does?
I forgot what they're called. Is it what you just said? Or is it something different?
All the vessels, right? All vessels. Not just veins, not just arteries, but all vessels dilate, right? So think of your heart as like a fire truck, right? I think you and I discussed this earlier, right? Think of it as a fire truck, like a pumper, okay? So you have the truck full of water, right? It attaches the hose, whether it be a 3-inch, 4-inch, 8-inch, whatever, right? You attach that hose, right? And then you go and you spray, right? If I attach a 2-inch hose to that pumper, right? That's going to be what? A lot more pressure, right? A lot more pressure. But if I put an 8-inch on there, is it going to be as much pressure? Okay, so when all the vessels get bigger, right? There's less pressure. So less pressure equals blood pressure going which way?
Less
Yeah, less means it means that the pressure is going to go down, right? So, if I'm at 100 and I go to 80, okay, not okay. Okay, not okay. What would you say?
It's going down.
No way.
Yeah, so if I give nitroglycerin to somebody that has a blood pressure of 100, the systolic, right? Because we can give it at 100 or more, right? If I give the nitroglycerin, their blood pressure goes down to 80, okay, not okay. What do you think? You think okay? What do you think?
Nope.
Tell me why, Laura. Why okay, and then why not okay? Let's go start with why okay first. Just think out loud. It's okay.
I was just saying it because you said it would go down.
Blood pressure is going to go down to 80. What do you think? Okay.
It's gonna go.
Mm-hmm. What do you think? Yes or no? Not okay? Why?
Well, I thought it was because you said that it would go down.
Uh-huh.
It dilates.
Okay. All right. What else? No? All right. Jacob, what you got?
Why not?
Yeah, why not? Why is it not okay?
Isn't it a systolic 100 to fully perfuse the body?
So systolic of 100 is pretty low, right? If it goes to 80, what's going to happen?
It's not going to perfuse the body, right?
It's going to be, the pressure's not very much. It's not going to go and perfuse the body very well, right? If somebody has a blood pressure of 100 and drops to 80, that's not okay. So what we're looking at is, are the side effects, right? Are the side effects going to affect, right, the health or the well-being of your patient, right? So that's when you determine when it's okay or not okay. If I give a nitroglycerin to somebody that's systolic of 100 and it drops to 80, not okay. Does that make sense? All right, that's how you determine whether it's okay, not okay. You weigh the risks with the benefits, right? Risk with benefits. That's how you determine if side effects are okay, not okay. All right, dosage. What is dosage? Simply,
How much is the medication?
how much you give, right? Good. All right. So for admin and assist admin, what I want to know is, can you give it without medical control? Or I'm sorry, no, let me go back. Can you give it, or do you assist in the administration of? Okay, so difference. You give a certain medication, you can give it, right? Or is it something that you can only assist the patient in giving? Again, we're going off National Registry standards, okay? And then I want to know how you give it, the route. All right? Any questions on those terms? All right. So, I'm gonna give you guys about I'm gonna give you guys 10 minutes. Get together, right? Collaborate. Collaboration. That's my favorite term. Okay? That's my favorite term. Collaborate. You two get together. I want all of these medications. I want to know this for every one of those medications. You can divide and conquer. You can work together however you want to do it. You two just get together and do that. I'm going to give you guys 10 minutes to do so, and then we're going to go over it. Any questions? All right, I'm going to set the timer, and you guys may begin.